Now we're going to start the first debate on whether healthcare is a specific business model. So Nicolas Bozou, Laurence Comte-Arassu, who's come from Reims, Jean-Jacques Zambrowski, Arnaud Romidet, and Julien Kouchner will be our moderator. Good morning, everyone. Thank you, Guy. Is healthcare a specific business model? That's our first topic. I think we can perhaps say without joking that yes, it is a specific business model, very different from many economies in France because it has a beautiful future. Obviously, the population in France is aging as well as around the world. There are going to be huge markets opening up to treat the European elderly. Now, in the European Union, the average age is 42, and it will be 52 in the future. And we will have a majority of people over 65. So it's an industrial and political challenge that's huge for France and for all of Europe. And I'd like to recall that in France, healthcare is 12% of our economy, 2.5 million jobs, and many of them cannot be relocated outside of France. And for many people, healthcare has no price. So should we introduce these ethical questions about the end of life and palliative care into an economic equation to start talking about ROIs, returns on investment? Well, some studies about the economy of happiness show that a deterioration of your health is what deteriorates your perception of your own happiness, much worse than even losing your job. So between 300 and 350,000 people will be diagnosed this year with a cancer in France, and it is this they must hope to cure, and they must also live with the disease. So what is the role of patients in this economy? And what are the proposals that we need to make to meet this societal industrial challenge? And faced with this equation, we are very lucky to have experts with us this morning, the best specialists on these questions, who've accepted to open the CHAM 2016 debate with me. We have Laurence Comte-Arassu, president of Medtronic since February 2015. She's also a member of the board of SNITEM, the National Union of Medical Technologies. She's worked in medical technologies throughout her career. She joined Medtronic. She has a master from Belfort and also a diploma from Glasgow. Asteres Nicolas Bozou is the founding president of Asteres. He's the director at the MBA Law and Management in Paris 2, Assas University. And you regularly can read his articles in the press, and his latest work is called Will Innovations Save the World? A Philosophy for a Prosperous and Peaceful World. Arnaud Romidet is with us in a video conference. He's an MP, represents the Marne since 2008, and he's the mayor of Reims, and he's a doctor and researcher and teacher at the hospital. He was a teacher at the medical school in Reims from 2006 to 2014, and he focused his research on pharmacology. He's the national secretary and member of the Bureau of the Executive Committee. He published an essay entitled The End of the Welfare State, Long Live Social Insurance. Jean-Jacques, do you hear me? Can you hear me? Says Mr. Robinet. Well, we haven't asked you a question yet. We just finished introducing you. Now, Jean-Jacques Zambrowski is a specialist in intern medicine, and he focuses on health economics. He also has a PhD from Wharton Business School. So we're all particularly focusing on the healthcare system, access to healthcare, the development of telemedicine and e-healthcare. The The first question I'll ask you is a simple one. What are we referring to when we talk about the economics of healthcare? Well, I think, first of all, this question summarizes everything, the economics of healthcare. It's a very exciting question because the definition depends on who is answering for a patient. The economics of healthcare is the resources that you're going to implement to treat the patient and provide the patient with better quality of life, a longer life for him and his family. For a healthcare professional, it's his mission, his vocation. Will he have the resources to do what he's been trained to do for the patients that he's in charge of? For a manager of the healthcare system or Social Security, the equation is different. How to manage the expenditures and the income. For a legislator, he wants to guarantee equal access for everyone to healthcare. There's another aspect. And then for sociologists and philosophers, for each person answering this question, the answer will be slightly different. In other countries, I think we've settled the question earlier between these interests and different positions. Different interests, different positions. And in other countries, for example, in the US, we see that the question hasn't been solved. And despite the attempts by President Obama, there are still 35 million Americans who are left by the wayside. So the word economics means to use your resources properly. But when you talk about this with the law on financing Social Security in France, which is being debated in the coming weeks in the French Parliament, we see that this is limited to the financing of just Social Security healthcare. And we're not focusing on healthcare in general. We're just focusing on illnesses. But the answer would be too long to complete here. So, Nicolas, what do you think is the real cost of healthcare and how we can measure the cost of healthcare? Measuring the cost of healthcare is relatively easy. What is difficult is to measure the value of health. In a classic sector, the question wouldn't even be asked because the value is reflected by the price. More or less imperfectly, but you can consider that the price of a hotel room represents about the value that the consumer attributes to this hotel room. That doesn't work in the field of healthcare because prices are set. So all of the prices in healthcare have no real meaning from an economic standpoint. When I hear people say that the TAA in the hospital sector means the penetration of capitalism or the market capitalism into the healthcare sector, I think that's a huge intellectual mistake because it's exactly the opposite. It's a penetration of the Hungarian system, a planning system of the 1950s, and that can be defended. I'm not hostile to the idea, but the question of a price in healthcare is very, very difficult to address. This doesn't mean that we have to think about the healthcare system without using the conventional economic analysis tools, which work very well, but you just need to keep in mind that this healthcare sector is very specific because we have two objectives. One is to be efficient and efficacious, and the other is economic. And we really need to become more relaxed with this question of money in France. Healthcare companies must make a lot of money, huge amounts of money, to invest and to treat us better. So it's important to recognize that we need lots of money in the healthcare system. And if it's managers who are managing the money, it's even better because that will bring in investors. So I think we need to become more relaxed about this question of money in France. But we're trying to be efficacious and also equitable. And this search for equality or equity means that the question is complex. And I'm fascinated by the healthcare sector, and I'm not a healthcare specialist. I work on many different sectors. But why am I interested in these healthcare questions? Well, because the huge issue in the world today is the fact that you have a huge wave of colossal innovation, or almost destructive innovation, as we say, that has never been experienced since the Renaissance. But at the same time, we have companies and states that remain rather rigid, which is normal. And it's the combination of the two that creates a certain amount of disorder. But in the healthcare system, this is multiplied by 10. There are many more innovations, and then also at the same time, much more rigidity. So it's very interesting from an economic standpoint. If you've read Darwin, it leads to extinction or Marx said it even leads to destruction. But neither destruction, nor extinction, nor revolution. I think it's interesting for an economist to really focus on the healthcare system so that we adapt to these economic and technological innovations. Now, we could ask Arnaud Robinet whether he thinks the PLFSS is well suited to address these issues. Can you hear me? Okay, I'm sorry. Now do you hear me? Can you hear me? Yes. Do you still hear us? Yes, I hear you. Did you hear the question? The PLFSS, which is a French measure, has been approved. Yes. Well, the PLFSS doesn't allow us today to define a healthcare policy, which was its objective. It's not its objective, really, or even to define an economics of healthcare. The PLFSS should be discussed over a longer period. I'm more favorable to PLFSS that we would vote every 3 years or every 5 years to have a true objective and a real pathway, a real itinerary that would be shared by all of the players in the healthcare sector. And I'm thinking especially of the healthcare industries such as the pharmaceutical industry, because we've seen in recent years that the PLFSS, these PLFSSs they define a 1 year, a short term in terms of expenses and income of the healthcare center. But in the financing of Social Security, we truly need to have perspectives in the medium and long term. When you talk about innovation, innovation is, of course, a lot of investment. When you talk about developing a drug, it's 10 to 15 years, and the healthcare industry can't adapt to PLFSSs that change every year. And we take a billion here, a billion euros there. There's no stability. This harms innovation. Nicolas, you wanted to add something? Well, fundamentally, innovation cannot be included in the PLFSS because the real growth of healthcare expenditures in the future that we should hope for is not 1 or 2%. Innovation won't generate rises in costs of 1 to 2%. It'll be 4, 5, 6%. It's wonderful. I hope that healthcare expenses will increase more rapidly. The healthcare sector is the only one in which we're organizing recession and deflation. In every other sector, people target growth. And in the healthcare sector, we're doing the opposite. We want less expenditures, and we want the prices to decrease. Now, innovation costs a lot of money, especially when it works well. It's expensive in the beginning, but if it works well, then everyone wants to benefit from it. These are debates that are very interesting that we had on hepatitis C. So we need to integrate this notion that, and I'm sorry to say this, I know it's a bit provocative, but it represents wonderful aspects. The healthcare insurance won't be able to cover everything in the coming years. So we're going to have to restrain ourselves in France and make an intellectual effort to understand what should be covered by solidarity and what should be covered by private insurance and even people's own income, own resources. When someone has a cancer, I think this should be covered by solidarity. We need public budgets that can also come from taxes, for example. I have no problem with that. It shouldn't be just social charges, but not just public Social Security. But when I go to the doctor with a minor problem, it shouldn't necessarily be covered by public solidarity. So if we don't want the French to pay for the cost of every extraordinary treatment that's arriving on the market, we're going to have to think of different types of financing. I want to ask Laurence what she thinks of this. Innovation. You are in charge of Medtronic in France. You've just heard that. How do you target growth, and how do you work in France, which doesn't necessarily take into account the innovation that you need? As Mr. Robineau said, we need stability. As industrial leaders, we need visibility. To come back to the debate, what is the economics of healthcare? For us in industry, it's needs. It's not our needs. It's obviously the needs of the patients. Yes, there's a market for all of these needs. There are many competitors in the market, of course, but this creates jobs. And innovation is also, obviously, job creation. It means when can we place the product on the market, and we all reinvest about 10% of our revenue. Why? For these patients. And the huge issue we have in terms of innovation today is that we have no visibility of the future. As Nicolas was saying, not only do they want us to work with even less budget, increasingly lower budgets, but then we have to think about the organization of this. And we'll come back to that. But if I have one key message to everyone in industry, on the part of everyone in industry, we need visibility. Who knows what we're going to make at the end of the month? It's not possible for us.
Jean-Jacques, yes, I think we need to understand the sense of dimensions and figures. Just to go quickly, last year it was 2,100 million in wealth. We devoted 240 to health, something like 12%. That's less than the United States, that is up to 18%, but it's more than England, that is at 8 or 9. Having said that, we have the average of developed countries in the West. Out of the 240 billion, you've got social security, obligatory social security, that's spent 195, in other words, 76%, three-quarters of healthcare expenditure. So you're asking what the healthcare economy is. In fact, it's a bit like the education or security economy. It's an economy that everybody takes part in as an actor. It's an economy that creates resources, employment, and means that there are jobs in safe security as well. But it's taken on board by authorities, and even in countries with a different system. I was talking about the United States. Medicare, for example, state insurance costs a lot. So it's a very specific economy in the sense that it benefits everybody, but it's regulated centrally. And as you've already said, it is fueled by innovation, because even if we're very happy about what we've already been able to do, there are unsatisfied needs, unmet needs. This is what we hear about in the literature, and they are considerable. Now, Nicolas was talking about cancer. We're far from having understood what that illness is and provide drugs that can care for it. We have some revolutionary drugs that extend life expectancy, but that do not cure completely. So we need this, and there's a paradox here. On the one side, you've got, for example, what our MPs, given the figures put forward by the ministries, what they vote for the financing law for social security. That takes into account the imbalance in public accounts. And then there's the necessity of going into the equation at European level. On the other hand, we've got obligatory growth in the healthcare system in our country, like in others, 4.5% a year. So the growth of our economy, let's imagine that we need to follow, and it's 1.5%. We're already at 1/3. So our MPs vote for 1.75 or 2.1. Well, we're far from what we need. So we need to impose savings on the system because of what's happening with the population growth, with the aging population, and then the progress that we're hoping for. So we're already in a stalemate, and the PLFSS that the MPs are going to vote for, it will already be in the situation of deficit before even starting, because every year, whatever the parliament in place, the budget, the income budget, is below the budget, the expenditure budget that is authorized. So we can talk about tutoring. By nature, this effort is not big enough, so the problem has not been framed properly. Perhaps a last question before we go on to discussions about the future. So 2017 is a very important year. The situation, is it desperate in France, or are things looking a little bit better in the healthcare sphere or in other spheres? No, in the healthcare sphere. Unless we want to change to the theme of CHAM 2006. No, things are a lot better. No, in the healthcare system, what we have to keep in mind is that the system is changing completely. And this allows me to answer your question. We could say that the French system for healthcare will perhaps collapse, but that doesn't matter as long as we have other actors taking over. I hope it doesn't collapse, but it may collapse when Microsoft announces a week ago that its priority today is to fight against cancer and that it believes it can solve the problem between now and 10 years' time. It's interesting. I think we have to take this seriously. Microsoft is managed by some intelligent people. It's a company that has a past, and that past is very positive. It's based on a lot of success. And undermining that would be an intellectual mistake. It would be a risk. The business models are being redefined. And I'm going to surprise you. We're not talking about the future straight away. You've seen that last week, Musk developed a Martian colonization program. Now, we're from France, so it's the future is not bad because where we're going, we'll be able to see what's happening. But it's very much linked to the health, what this Musk up. So if they want to colonize Mars, it's because they think that they can set up investments that will make it possible to live a lot longer. Again, we mustn't undermine this because this is an organization that has succeeded in the business sphere, even though a rocket exploded last week. It's a small failure for them. So this business model is changing completely. I think we're going to have new stakeholders in the future. We're going to have new actors in terms of financial coverage. So the PLFSS, I don't know, is 2017 is going to be the best year? Are we going to be able to fill in the gaps? Yes, that's all well and good, but I'm not saying that because I want to criticize the government. The government does some good things from time to time. But we're really, not concentrating on the right subject. Arnaud, would you like to add something? Yes. I want to react. So, talking about stability, I meant visibility. So I understand. When I talked about stability, can you hear me? When I talked about stability earlier on, I meant visibility, so I agree with what's just been said. So let's go back to the healthcare system. I think that today, and this is what Nicolas was saying, our system today needs to be reinvented because we've got social protection that dates back to 70 years ago. 70 years ago, it was 70 last October, and that sector is changing. So we need to look at digital healthcare. This has modified medical practices, and this has had an effect on the healthcare system. We should be more efficient in the future. And then there's the question of financing. Now, it's a shame. I was looking at all of the proposals of the presidential candidates. We're talking about networking, but we're not talking about the financing of healthcare. What about the role of social security? What is the role of additional healthcare companies? What are the additional means that we can set up to guarantee this healthcare system, make sure it's of good performance and accessible to everybody? So this is the heart of the matter. So the PLFSS, the system is dead. It has to be completely reviewed, and I'm saying this, we need to give to the healthcare industries visibility, stability, and future prospects. It needs to be a win-win situation. We need to define the objectives together. What are the means that are being set up in terms of financing, innovation, and research? Because behind that, it represents a lot for our economy, the healthcare system. But unfortunately, it's a healthcare that is losing jobs. There's a lack of trust between the public powers and the industrialists. But the healthcare system, as we know it today, from the point of view of financing and coverage, it's out of breath, and we need to invent another model. Thank you. So, reinventing another model. Before reinventing that, Laurence Contreras, how do you create value in the healthcare sector? How do you define it? And how do you work with healthcare establishments in the short term? What about long-term proposals? Well, there are many points to that question. So earlier on with Mr. Zaborski, we were talking about the value. Each person has their own definition of value. As industrialists, and we had a strategic committee meeting last week. To come back to your previous point, I think we can be optimistic because if we look at the very short term, we say to ourselves, okay, the decisions of the CEPS on the 3rd of August, that's terrible. We're told that you've got 30 days to answer, and we're going to look at 15% for prices. What we're saying is if we work differently and if we manage to do it together to create another ecosystem with many people, many companies, economists, and people from the administration, we we can certainly think about things differently and do things differently. And it's this case that we need to look into. I think we need to be clear. We need to use simple words so that patients understand. Patients have needs. What are they interested in? What do they want? They want their needs to be met, their expectations to be met. And not all patients are the same. Even a patient who suffers from whatever therapy doesn't have the same need as another patient. And I think that we all need to say to ourselves that we are healthcare citizens. We are French citizens, and we all have people who are ill around us. For some patients, just to be very clear, what are they expecting from the idea of value? Well, for some it means being able to take their dog for walks. For others, it means doing sport. So you can see that what the patient is expecting is different. So we're working on that need, on the value, the idea being to achieve the best ratio between what the patient is expecting and the cost. Because as Nicolas was saying, value is what the patient expects over the cost, and that's the balance that we have to look at. And alongside that, and that's why we're optimistic, alongside that, well, we're not going to be able to do anything about this unless we create different business models, or economic models, as we say in French. So my two neighbors are in a better position to answer that kind of question. But that's why we need to have a different ecosystem, because it's all together that we can work on this issue. So managing a bariatric patient today, should we be operating that patient or forgetting about that patient? No, we have to start with the diagnosis. Maybe we have to operate or not. And then there's all the monitoring. So today we're cutting things up, but we're not taking the whole picture into account. And so there are many models that we need to rebuild. So I think we need to be worried in France. Is somebody going to decide to kick this pile of hay? And Nicolas often says this very well. The world is moving very quickly, and we're going to be able to continue to live in a system that is over 50 years old. No, I think we've got to use simple words and explain to the whole population that it's just not possible. So how can we do this? Well, we need to come around the table as we are today and talk. I work for an American company, like many of us. In France, we talk a lot. Well, let's try and act now, and let's try and show what we can do that is different. And to be able to do this, I think we all do it at our own scales, but there are different ways of doing it. The aim for me is not, I don't want to talk about my own company, but let me use some examples that concern everybody. In the room, among others, there is the general manager of the University Hospital in Rouen, who has an RHU that's been accepted. We've been working together with them to enable them to have that possibility to continue to work on value. The establishment in Strasbourg is doing the same thing, the University Hospital in Strasbourg. There are other people in the room, Europe Assistance, people who can help us, who can help us to think about how we can provide patients with something different, how we can give back time to doctors so that these patients can be dealt with differently, so that we can look at what's important for them, value. So if I understand what you're saying, you're putting the patient right at the heart of the system, that's right, and you're making the patient a customer. Now, is that the main driver? Patients should be seen as customers. Thank you for asking that question, because I was going to raise it myself. Now, I hate the term patient, of course. We're talking about customers. We shouldn't use the wrong names. And I don't see what there is in the word customer that is pejorative. I can push it further. I believe this. And I think I'm right. So basically what we need in the healthcare system today is more liberalism. That's what we're talking about. That's what we should be talking about. Then the question is, how do we do this practically? I think there's a notion that we need to work on more, and that is the notion of autonomy. I'm not saying that because I just think it, but the people I meet, I find extraordinary. I admire them. I'm talking about healthcare offerers, hospital people, and ARS people. So, to what extent should we modify a system without having the authorization, the ability to do it? Well, I think it's It's admirable. So all of these people know what has to be done. They know what has to be done. So they need to have more room for maneuver. So we've devolved the system essentially with the regional healthcare authorities. So we really need to give back authority to different regions, let them to experiment. This can only be done locally, because when you do it nationally, you fall into a trap, and the healthcare system has fallen into this trap many times. In fact, the whole public sphere in France, and that is the centralized evaluation system. There's nothing worse. For many years, we didn't evaluate everything. Now we evaluate absolutely everything. And when you've got a centralized system and you've got quality indicators, you've got to multiply them, because you realize that they're always imperfect. So you have to have even more. And then you allocate more resources to this, to looking at indicators and measuring the gap between reality and the target indicator. So that's no good. We need to have a much more decentralized system with the right kind of skills for healthcare people. Broader scales. It means that we need to come out of the cooperative model. So we're talking about vaccinations against flu in the country at the moment. Look at all of the changes that we've described. Being obliged to go and see a doctor to have a vaccine is an example of what's going to kill our healthcare system. Of course, it's not the doctors who should be vaccinating. We should be able to have a vaccine given to us by a chemist. No. I don't like. It's stupid for the doctor. It's stupid for the patient who has to pick up illnesses in the waiting room. And it's stupid for the taxpayer, because they're paying twice. So all of this is absurd. So we need to extend the skills of people. We can do this. There is a healthcare sector where we've done it, and that is an interesting sector, and that is the visual healthcare system. We've given a lot more skills and authority to opticians who were not healthcare professionals, but little by little they're becoming healthcare professionals. Ophthalmologists didn't want to do this to begin with, but now they think it's great and they want to go even further. And we're moving towards a German kind of system where the ophthalmologist in Germany does one thing, and that is eye surgery. So it's very interesting for him, and he's very rich, and it's all benefits for him. So we need to have we need to break down the silos. We're in a period of change. The silos are becoming rotten. So we need to use skills that are inside the healthcare system in a much more flexible manner. Thank you. That was a first very good example, the example of vaccination, and I think that will get some of our doctors to start treating. But beyond that, yes, I hope they're very happy, because it's the only way for them to be saved. Right, okay. Well, I think you will have some other tweets about that subject. So, if I've understood properly, you are for a major liberal shock. What about everybody else around that table? Do you agree with that? So less regulation and more liberalism? I think we need more freedom. I don't know whether it's really liberalism, because there's a specific connotation to liberalism, but we need more freedom, more liberty. And this is what Nicolas is inviting us to do in his own way, that we appreciate, of course. So we don't want to remain within these silos, these partitions. So it's all about delegating work. But we need to have something in exchange. We don't want pressure. We don't want to lose part of our resources or credibility because of this. Now, surgery today, eye surgery has made a lot of progress today. And an ophthalmologist who is trained to do surgery in a hospital rather than prescribing spectacles wants to do this. But the techniques, the tools, the equipment available, the population aging, so more cataracts to be operated, this all means that this is a very happy reconversion for the eye surgeon, for the ophthalmologist. It's very good intellectually, financially, and so they can certainly delegate the prescription of spectacles to opticians, vaccination for pharmacists or chemists. You know, as long as doctors have their revenue, they want to keep it. 25 euros it is for doctors. But as long as they become the healthcare professionals that they should be becoming, given their training, so rather than civil servants filling in papers, then we'll agree to this idea of pharmacists being in charge of vaccinations. So I would like to come back to one or 2 points very quickly. First of all, where does the PLFSS come from? Because we've looked at that. It comes from the fact that in 1996, the Prime Minister of the time, Alain Juppé, had said that the deficit had reached an abysmal figure, and it looked at how to solve this and how to reuse what was redistributed. It came out of that the Social Security financing law. It's not a budget because the Social Security is not the state, but it was the national representation that expressed on our behalf how much are we going to contribute and how is it going to be used.
Having said that, it's become so sizable that it represents a healthcare law. In the modernization law, Madame Bachelot made one, and there was one more recently by Madame Touraine also. But we don't have a long-term health policy in general. We have, we try to do a little facelift here and there, but we have no real political will to change the healthcare system in France. And our politicians in the coming months and years are avoiding these topics because they're difficult topics, because they concern life and death, because there are huge stakes for everyone, so everyone avoids the topic. But the result is we don't have a healthcare policy. We have politicians taking care of health, and that's not the same thing. We have a retrospective vision and not a prospective one, a forward-looking one, and that's clearly a problem. And when we look at value in there, value is something that has evolved because the healthcare challenges have evolved. We talk about poor eyesight or cancer or heart failure or diabetes. What's really creating value today and that can be perceived by all actors, patients, practitioners, companies, the value of all of this has changed in the last 20 years. The expectations, the offer, and there's no policy, so there's not been any adaptation. There are all kinds of measures that are being taken. I'm not saying that our administrations and politicians aren't working on it. They are working a lot, but they have no strong direction that everyone can agree on. So we'll listen to one of our politicians on this topic now, Arnaud Robinet. Should we change the tools that we use to assess? And I'm not sure if I need to ask you this question. Do we need more freedom? Changing the measurement tools, the assessment tools, yes, but only if we change the system, because changing the tools is pointless if the system is not evolving. I hear more freedom around the table. Yes, of course, more freedom, but more responsibility, more empowerment. Also for the patients, I've heard that we have to bring the patient back into the core of the system, but we need more responsibility in terms of the doctors. I agree about certain things. Vaccination should be done by pharmacists in the pharmacies. They're healthcare professionals because the GPs do a great job, but you can't have them to have more medical time, less administrative time, and continue to want to vaccinate. It's not that it's not a noble task to vaccinate, but doctors have other things that they should be doing, more important ones. And beyond that, we need freedom in the organization of the healthcare system. More autonomy, yes. More autonomy for the hospitals. Hospitals have to find their true mission of excellence, research, innovation. We can't ask hospitals to take care of everything. And hospitals, depending on their regions, must be able to decide on their objectives, particularly in terms of recruitment and management, and I think that's vital. And that's why, as opposed to what some of my colleagues in the opposition think, I am in favor. What I see going on in Reims, today we've tried to set up GHTs, but not all territories are working in the same way. The healthcare offer is not the same throughout the country between the public offer, the private offer. But if we can improve things, it would allow us to have more autonomy in the management of several different types of public establishments. In public hospitals, we're moving towards more outpatient care, but the GPs have to be more modern too, and to take on patients who are leaving the hospitals on the same day as their surgery. What about these medical centers, what they call in France maisons de santé? It works sometimes. It was very expensive for the local authorities. They've invested in buildings and in infrastructures without doctors sometimes, and I would rather invite doctors to create their own networks, so GPs, specialists, pharmacists, the paramedical professions, they should all organize themselves, and with more freedom, we'll make the healthcare system more flexible. And if you say more flexible, you're saying better access to healthcare for our citizens. But careful, in this country, liberalism and liberty are bad words. We shouldn't be afraid of liberalism nor the word liberty or freedom, because with a state-run system, one that's in silos, we see today some negative effects of our system. It's not a fair system as it stands today, and we need a better health system. Health is expensive. It's not free. There's always someone paying for health at the end of the chain. So I don't know what time it is, but I think that we're running out of time. I'm going to ask 3 questions to you. Firstly, you, Laurence. In my introduction, I showed that there was a big future for France and for Europe. And in this global competition, do you think there's an industrial policy that we can put in place in France and more widely in Europe? Yes, of course. As an industrialist, as a company, for us, we propose to patients and to the healthcare industry medical systems. Medical systems are very structure organizations. And if we really work on these innovations, on these medical devices and systems, we will create employment. And we talked about this ecosystem where we all have to work together. Well, we have an incredible chance in this country. We have doctors that have an ability to work with us. We have some of the best innovations resulting from that joint work. I'm trying to go very quickly, but if we can work with these doctors and we can set up these innovations, set up pilot projects, and then disseminate them, because we're the champions of creating innovation, but we're the worst in the class for disseminating them in our country. And most of our companies sell their innovations abroad more than they do in France. So we need our patients to benefit from these innovations. We need to disseminate them. We can grow France, we can grow Europe, and take our right place in health worldwide. I don't agree with the fact that we need an industrial policy. That's giving money to companies. You never know where you're supposed to give money, and I think if I don't know who I should be giving money to, I think that's the case for other people who are in charge of this. We need to have a patient-centric policy in the same type as spirit as the 1945 law. Everyone has to have access to excellent health care, regardless of where they are in the country. This is sufficient, and we can roll out the value chain of the healthcare system based on this simple objective. This means that very quickly we need to have more money for care, and I'm not going to make friends again, but we have to ramp up the role of healthcare, complementary healthcare insurance. They have the money, and since they have the money, and since they're going to be additionally involved in finance, they're going to be able to regulate some of the healthcare networks. We need to move in that direction, and we also need to ramp up the added value of all levels of the healthcare system. Pharmacists do more, doctors more in terms of quality and quantity. They need to improve their competencies like we see in Germany. And where I agree with Laurence, and I'm not saying this just to agree with her, I think we have an exceptional healthcare system in France. Look at our cancer treatment centers. They're unique worldwide. And I'm sorry to take this Paris-centered example. Gustave Roussy, everyone looks at this structure saying it's an incredible hospital. It's got a weird status, a public-private that has some of the best technologies worldwide, and all French people with cancer can go there. So we can't lose that type of thing. And the objective of the reform, as the British Conservatives explain, the objective of change is to keep what's good. Thank you. I still don't know how much time I have left. We'll continue, because clearly I have as much time as I'd like. Yes, and we have more and more free time thanks to digital reform. That's the question I wanted to ask. We talked a lot about the economics of health, but we didn't talk about the impact of the digital world. I'd like all of your points of view on this question that I think is a vital one. Are we moving towards the Uberization of healthcare, or major innovations and basic changes that will place France at the center of these changes? I don't think we should focus on Uberization. In terms of public transport, it was an opportunity to transform traditional transport. Uber obliged taxis and buses to change their models. Look, since we're focusing on Paris, look at the center of Paris to the airport. Uber changed the way it's working, and we're even going to create a metro a line that goes out there. So this amateur that comes in and causes change is a good thing. Will digital change the world of health? Yes. Digital will change everything because of data to begin with. Today, we have the offer of big data in health. Once we've solved the problems of confidentiality of individual health care, and we can improve the way we deal with epidemiology to adapt offer to our real needs. Needs and demand are not necessarily the same thing, but we can measure them now through big data. We can improve the way we work, and today there are tools to improve performance and care. And this is a way of avoiding the redundancy of medical acts that take place in the cities today with approved means of biology and radiology. And we do the same thing in the hospital. So we need to make sure that the information is going from the hospital to the GP and the GP to the hospital. And so there's a gap there today that is damaging the efficiency of our healthcare system, and that is the objective of Article 62 of our healthcare plan. And the digital world will also make it possible to transform that. There's some incredible tools that are being made available by computing. The telemedicine that we talked about yesterday in the workshops. There are specialists from all horizons: medicine, technology, network management. It's a mine, a wealth of value for us to improve health, to improve proximity, provide better equity. As Arnaud Robinet said, we're also going to reduce costs. We're avoiding transport. We're avoiding hospital stays. So we improve all of this for patients, hospitals. And we know that sometimes the economic impact of some diseases is very high. Earlier, we talked about cancer. The pan-European study done by the OECD 3 years ago proves that healthcare costs 7 billion euros, and the losses associated with productivity losses were roughly the same, 7 billion, and the cost for families was 2.5 billion. So digitalization will be a way of better tracking all of this, of better knowing what's going on, of reducing the expenses. There's enough being taken from companies and private citizens to finance health. These budgets are not appropriately used right now. The quantity of resources with 240 billion, we can deal with the health of all of our citizens in France, the over 66 million of us. We only have 6 minutes left, so I just wanted to focus on how important digital is in healthcare. My question is, are we well positioned to use the digital technologies in France? Studies have proved that it's going to revolutionize the system, but what is our placement? No, we're not well situated right now. As I said a few minutes ago, our organizations are extremely rigid and conservative. We can understand that, but let's not lie to ourselves and say we're well placed. It's my last question, Nicolas, so let me just add something. Do you think that there's a reform that's been done elsewhere that we could learn from and apply to France? No. All countries are looking for solutions for healthcare right now. They're all very rigid systems with a lot of laws and regulations. Let me give you a tangible example. You used a term that I'm interested in that we didn't talk about. That's the Uberization of health. Of course, there are segments of the value chain that will be Uberized. And I'm delighted by that because I think it will be real progress. General medicine, I know, a GP. I'm going to continue to talk about GPs in general medicine because that's really what we're talking about. It will be Uberized. It's already started by platforms. They might not be managed by independent workers, but we will be able to put doctors on these platforms. The business models of these companies that are networks, their business models, specific microeconomy, so their value increases with the number of days that they're in the network, so they progress very quickly. And very quickly, you're getting oligopoles, oligo centers. It's not a problem for doctors, and it's great for patients. Each time there's an evolution of this type, we're all saying it's horrible, it's bad, it's new, we're not going to be able to care for people properly. That's not true. Not only do we have to accept these changes, but we have to be happy about them. We need to like these evolutions. We need to buy into them, and that's what interests us. What interests us is the end customer, the end user, which is the patient. Arnaud Robinet, the place of France in the digitalization of health. Well, if we want to modernize our healthcare system, we have to really take control of the digitalization of the healthcare system, or Uberization, if you like. I'm not afraid of that term. It's a change, and we'll be actors rather than observers. But we have some cards to play. We have startups, we have companies that are investing, and I think we can focus on what's being made in France, but we need an ecosystem behind that that allows us to develop this digitalization of health. Some are afraid of this, saying that the patient will be in charge of their health. The patient needs the contact with their pharmacist, needs contact with their doctor. However, digitalization or Uberization will play an important role for prevention, primary and secondary prevention. And then when we talk about Uberization, let me talk about telemedicine here. Doctors, their consultation, their visit has to be taken into account. The minister is saying we're going to experiment with this. Well, we've been experimenting with telemedicine for the last 10 years, particularly in cardiology. And today I think we need to ramp up. We need to take into account the time that the doctors are spending in terms of their analyzing data that's being sent to them by such or such connected objects. So it's an ecosystem that has to be set up in terms of the financing of the medical visit, the consultation, and also the economic and industrial ecosystem has to be examined to see how we can accompany this. We have a real gold mine in France, and we're seeing these companies doing very well in the US and abroad, but we cannot ignore digitalization and connected health today to improve and modernize our healthcare system. We've looked at taxis and other fields like the hotel industries with Airbnb. Everyone has to improve, everyone has to go a bit further, a bit better, and sometimes really challenge themselves. But for me, this question of connected health or digitalization is a real opportunity that we need to grasp and we need to work with. Thank you. Laurence? Do we have the right conditions in France to benefit from this? I agree with Mr. Robinet. If we come back to earth, we talked about telemedicine and cardiology. We have the same thing with treatment of diabetes and neurological disorders. If I had just one wish, let's be brave for a change. Let's stop hiding behind things that are not true. We know how to use telemedicine in France. We're being given legal reasons and all types of reasons, but it's really financial. Let's be brave and let's say this is a huge opportunity. And with telemedicine, we'll be able to rethink organizations. And if we rethink organizations, we'll be able to re-inject cash elsewhere. Perhaps not at ISO cost, but I can't say that if it's what proportion it will be, but it will be possible and very quickly in France. And that is just a question of courage, and the ecosystem is very important because we all have a role to play. In just a few weeks, we could have telemedicine up and running in France. That is a certainty. Thank you, Guy. I think we're on time, so we'll conclude, and thank you, everyone, for having participated in this debate.